It's been a concern of mine in the past that investigations into manipulation, particularly, let's say, C-spine manipulation, have included evidence from a whole swathe of practitioners. And it could be argued that, and again, I'm not anti-physiotherapists, let's say a physiotherapist has gone on a weekend manipulation course. It could be argued that they might not have the skill of an osteopath or a chiropractor who's been doing this for years as a student and then years as a trained practitioner. And that would distort the effectiveness of the research because they won't be doing it as well.
I'm going to be the devil's advocate
Okay.
here. That physio probably did a placement in neurology, and they've done a lot of work around neurology and doing cranial nerve assessment and stuff like that. Right. And therefore, if the manipulation is not what matters, but it's the pre-screening that is really important, physios might be much better than others. Mm-hmm. So I'm not really sure that this sort of difference between profession is very meaningful in these sort of discussions. Because I really, well.
But you did say that it's the extreme movement which is likely to cause the damage. Okay. And those people who are less well trained in manipulations are likely to use much more movement, much more rotation than those who've done in-depth training. Perhaps.
The evidence doesn't really suggest that. When you look in very experimental conditions about, I think it's cervical manipulation, but also thoracic manipulations, and you look at experts, and they were considered expert, I think, with probably like 20 years of clinical experience, with novice, which were just graduated manual therapists. I can't remember what the background was. I think it might be in chiropractic. And they looked at the specific effects of that manipulation. So it's a little bit different from what you were saying. It was exactly the same.
Right.
So this idea that our specificity is getting better with time, our palpatory skills and all that, is a narrative that is really important in our profession. And I'm not saying it's not true. I'm just saying that the evidence is not really suggesting that's the case.